welcome back to Bloom. Having a beautiful and youthful appearance is important to most of us. We all want to look our best, and having a doctor with the artistic skill and the right procedure is especially important. Joining us to talk about the art and science of Botox is Dr. Ann Hermann of Hermann Wellness. Welcome back, Dr. Hermann.
Thank you.
It is great to have you here. I always love when you bring the science of these beautiful procedures. And before we talk about that, you've been practicing here in the Tampa area for almost 2 decades. Why is this important to you to be in this area and to bring the art of cosmetic aesthetics?
It's very important to me to help patients look themselves, but also kind of stay looking the same for decades.
Yes.
You know, I mean, a lot of us, we enjoy our lives and we just want to keep doing what we're doing. And sometimes that's feeling better, and I work on that as well. But also, you know, just being able to work and communicate to other people and how you present yourself in the community. Sometimes little things can just make a big difference in your life,
and
really.
sometimes that's confidence.
Yes.
And it's nice that you can actually help bring that to people.
And non-invasively.
So I think Botox is one of the more sort of talked about procedures, but what is the difference between good Botox and bad Botox?
Yes. So it is an art. You know? Medicine is an art.
Okay,
Botox is an art. So you can do Botox in a way that still allows you to move your muscles, facial expressions. I do have Botox, but I can still, right?
Okay, so you've had this procedure as well. Okay.
And so a lot of times people do look at me and they say, you know, I don't want to look like a fake person or a Barbie doll, or they'll name some
and that's kind of what Botox
celebrities that are really
if it was done poorly.
Yes.
Okay.
Right.
And you want to do it well.
Yes. So a lot of times when I'm with a patient, we're going to talk about, you know, what are you looking for? You know, first of all, maybe they don't want to address anything except one area. Then we'll just focus on that, and then I'll ask, do you want still movement and to look natural? In which case we'll go with a lighter dose. Are you looking, you know, for a heavier? Yeah. But obviously, I would never do anything that would look too heavy. But you know, it is helping determine what the patient wants, and then sometimes people will ask for things that they just shouldn't have. And also making sure that, you know, we stick to what's going to look good.
So you're using your expertise to listen but also guide.
Yes.
So how is Botox administered?
So we use tiny insulin syringes, the smallest needle available. We actually use multiple syringes, so we're not injecting with them more than once or twice at a time, and that helps make it more comfortable.
Okay.
And pretty much you maybe have little poke mark. I mean, pretty much almost nothing. It takes a few days to kick in, and then it lasts about 3 to 4 months.
Oh, awesome. I think we have some before and after pictures I'd love to look at so people can get an idea of the results. So what was this one?
So this is the forehead, we would call that. And you can see.
Nice and smooth.
Yeah, and her brows still look good. Doing the brows and the forehead will also help with the arch.
Okay,
you know,
let's look at another one.
Yeah.
And this is an easy process. I think a lot of us think about the frown lines.
Yes, the frown lines. And so we call that the brow. And that also helps sort of lift, you know, and open the eye a little, as well as prevent that sort of the 11 lines there. And then this is crow's feet.
Okay, so you do
men and
those
women.
areas. It's good for men and women. And is this for correction or can it be used for prevention?
Both.
Okay.
So how a line is formed is by sort of moving a certain muscle over and over again, creating a crease, say in here or at the crow's feet. So if you're always frowning, eventually that line will become permanent. So typically I'll tell people, when is it time to have Botox? When you start to be, when you're relaxed and you can still see the line.
Okay.
You know, everybody can make a line when they frown.
But it's when you're relaxed.
It's more that when you're relaxed, if you're starting to see it, then if you do a little Botox, it will prevent it from becoming a permanent line.
I love it. This is a great procedure.